Okay, hello everybody. Hello, welcome to the Early Late Show. My name is Joe Brown. I'm an associate professor at UNC's Water Institute, and we're really happy to have this opportunity to connect with people who maybe because of time zone differences are not joining us synchronously, but we want to make sure that we connect with the global community, and we really appreciate the opportunity to say hello to all of you. What we're doing this evening is we'll talk about what's been going on at the conference today, some of the themes, and we'll have a discussion around those. And I think with particular attention to issues that may be of interest to folks in the Asia and Pacific regions. I'm joined tonight or this morning, depending on where you are, by a number of panelists who I want to ask to introduce themselves now. So do you want to go ahead, Mava?
Hi, everyone. My name is Mofa. I'm from Indonesia. I'm a lawyer by training, and I do research in mostly regulation, policy, and water law. Thank you.
Sitaram? You're muted.
Yeah, so good to be here. I'm Dr. Sitaram. I'm an orthopedic surgeon by training, but a public health and development person by passion and practice. I'm with an organization called Swami Vivekananda Youth Movement, and I'm active office bearer in a network called FANSA, Freshwater Action Network of South Asia, which connects to many grassroots NGOs, CSOs across all the 8 South Asian countries. So that's what, that passion is what brings me to the water conference here, and good to be with all of you.
Great. Juliet.
Hi, everyone. I'm Juliet Willits. I'm from the University of Technology in Sydney. So it's not actually early or late here in Sydney. It's 2 o'clock in the afternoon. It's a very humane time to do a meeting. So I lead a team that works in international development in Asia and the Pacific. And in WASH, I work across rural water supply, urban sanitation, rural sanitation, from quite technical issues to quite social and governance issues. And it's great to be here in our region today. Thanks, Joe.
Yeah, Relvi, are you with us?
Hi, Hi, everyone. I'm Relvi Boilapa, and I'm the WASH portfolio manager here in World Vision Vanuatu. So I have a staff of about 14 or 16 who are spread across all the different provinces where World Vision Vanuatu does its WASH programming. And happy to be with you all today.
Great. Last but not least, Jay.
Hello, everyone. I'm Jay Graham. I'm assistant professor at UC Berkeley. I'm especially happy to be here. I haven't been to this conference in a while, so it's really good to be back. And I voted today. That's what I was trying to show you all. I'm really excited that I got out and voted. But I do research in the area of water sanitation and hygiene and infectious diseases. And I focus a lot on One Health issues related to animals and zoonotic enteric infections.
Excellent. Okay, so ladies and gentlemen, that's the panel of people that we have tonight. We'll be talking about a lot of stuff. But first, I have a brief little presentation, kind of recap of the day that I want to bring up and provide a little bit of commentary just to get us started on what happened at the conference today. Okay, so I'm going to share my screen. Here we are. First of all, just to show folks, if you haven't been to the website, it's really easy to navigate. I'll give you the address in a moment. But on Wednesday, we're on Wednesday here. You can scroll through all of the different sessions that we're on today, starting with poster sessions. And the poster presentations are actually quite interesting because they're really brief, like 2.5 minute videos of the people talking about their posters. And there's also a document of the poster you can see. and they're organized by theme, across behavior change, sanitation, and so on. Then there was a plenary session today, which I'll talk about in a moment, and it's here. And there's a video there. You can also access the chat that was part of that session, and you can also look at different files that people may have provided as accompanying material to the session. So after every session, the recordings will be archived here for your use to go back and check out. Just going back to Wednesday, for some reason it always resets to Tuesday for me. There was a session on sanitation here. There were a variety of verbal presentations in the afternoon. I'll talk about some of those, and a couple of side events in the evening, and now we're here. So you can see that it's organized by date, time. It should be really easy for folks to navigate all of the different content on the website. So I'm gonna move to my little presentation now. So yeah, we're at the early late show. And what I wanna do is, we've already done that. There's the website for the conference itself, which you will have seen. And this is just another little a guide to the things I mentioned. You can look at the chat and so on the videos. So today's theme was inequality, and this theme appeared in a number of different sessions today, most prominently in the plenary, which was addressing systemic inequalities in WASH. And it was a really interesting session that I think at points got very philosophical about systemic inequalities in WASH space and really in development generally. The way that the practice of international development and aid priorities are often in conflict with goals of promoting equality among people. And the panelists included these folks. I just showed a picture of Joanna Fatch, Madhu Krishna, Just Nancy, Maitreyi Das, and Nick Hepworth, in addition to Aaron Salzberg. And a lot of the themes that came out in this session were really around the unintended consequences of WASH development in ways that reinforced inequalities among people. And that in turn drew on, I think, a lot of interesting and thoughtful discussion around the various biases that we bring with us in our work, the assumptions that we make about communities or what communities can afford to have and what they should have. For example, setting priorities for rural water supply, which may be at a very basic level of service, just assuming that is the thing that will work in that community, and not maybe asking the community what level of service they're interested in. Not approaching our problem spaces with an open mind. So not listening came up time and time again in the discussion, that we in WASH need to do a much better job of paying attention to the power dynamics that we bring to the table, listening to people that we are supposedly trying to help, and really leading with our ears and not our mouths. So that came up. There were a few quotes that I pulled out here, but a lot of this relates to just some of the deficiencies overall in international development. And I thought that was really interesting and something we needed to hear. I mean, this is globally, we're in a cultural moment where a lot of people who haven't been thinking about inequality very much have started to pay a lot of attention to that. And obviously it's not news to most people on planet Earth that we live in, have some deeply unequal dynamics happening in our work. But it's something that I think everybody was appreciative that was drawn out and discussed a little bit. The other major session that happened today was this special session on sanitation, which was called New Pathways to Action and Scale. And it was convened by Clarissa Brocklehurst of UNC and had 4 panelists. And the panelists included Joyce Kisangani from USAID Wash Pals, Kellyanne Naylor from UNICEF, Barbara Evans from Leeds, and Dr. Canisius Kanangire of the African Ministers Council on Water. And they started out with a brief discussion around, where sanitation is and where sanitation investment is, and the need to get to engage with governments to achieve sanitation scale. And a lot of the discussion was frankly around how governments operate, how governments do their business, what governments want to know, what evidence they draw on, and how to really speak the language of government to make the case that sanitation is something that deserves sustained investment. Because we all know that the way to get to scale is through investment, right? And so there was a lot of discussion around that. Joyce gave a great presentation around subsidies, targeted subsidies, and scaling up sanitation. Dr. Kanangire talked a lot about the enabling environment for sanitation and policy guidelines in Africa. Barbara gave, as always, had some great comments and presented a little bit about her study that looks at estimating the costs of delivering urban sanitation. And there was a little debate toward the end around whether sewerage versus on-site sanitation is more appropriate in urban areas. So that was really interesting. Kellyanne presented a little bit around this report that's going to come out on World Toilet Day, November 19th, that's called The State of the World Sanitation, which sets out an investment case for sanitation by government, looking at the return on investment. So those were the main things that happened and some of the themes that were brought up. There was a variety of verbal presentations. There were two sessions on culture and diversity and two on water. And there were some other presentations. I think some people sat in a few of them and can talk about them. I was really interested in the sort of remote water quality monitoring sessions. There were a few presentations on this theme, including this one from Mozambique, where I do some work. And finally, don't forget to check out the posters because they are really interesting, a lot of them, and they're brief. So you can read them and look at the presentation in 2 minutes. There's one around on the design of chicken sheds in order to kind of separate chickens and people, and the value of working with people to create better solutions. Norms around sanitation in India, which was really interesting, and lots of other things. So including some kind of really interesting science around, in this case, the shared microbiome between animals and people in Bangladesh. So I thought that was really interesting. So yeah, just a few highlights. I'm going to stop sharing now, and I want to ask some of the panelists to reflect on anything that they found interesting, if they've had a look at the conference material today, or if not, to offer other comments. And maybe we should, why don't we go in the same order that we went in for our introductions, if you remember what that was. So Mova, please, would you please start? Okay,
Thanks, Joe. Yeah, because I have a legal background and inequality, if you heard the jargon, equality before the law, it's something that lawyers really like. So inequality is really an important subject. And I agree that in many cases, inequality is systemic. For example, the inequality between the rural water supply and urban water supply system in Indonesia, I think that happens because of the informal character of the rural water supply and the lack of recognition of rural water supply by the state. So what we're trying to do is we're trying to push towards more recognition and trying to push for more formalization of the rural water system. And there has been some development in which we have some laws and standards and regulations which incorporates the rural water system into the law. So these are the kind of development that we have. for example, now we in the water quality regulation amendment, which is currently being drafted, we try to differentiate between the quality for rural water supply and urban water supply. Now, this may spark a debate: why should the parameters be differentiated? But I think it is important for us to have a certain standard for the rural water supply, which can be enforced. The rationale behind this, I think it's from my previous research, I encounter also some arbitrariness in the rural water supply system. For example, because we don't have a standard in the villages, then the proximity of the customers to power is going to affect the repair or maintenance. So I have something which is broken and you don't know the CBO person, because the CBO person usually becomes a local elite and they are not closed, and then you get you don't probably get repaired that soon as compared to when you're close to them. Another sort of phenomenon which I also witnessed is, for example, in a cultural setting where the community elders are granted more access. For example, in a village, in a location where we have a hamlet and standpipes, then the project needs to put the standpipes near the community elder in order to smoothen the process. It is unequal, but I think it is important important for the project in order to smoothen the process. Those are the other sort of inequality in the rural. And probably one example just for the urban water supply that we are trying to push also in Indonesia is to get people involved in the business planning process of water utilities. This is because we see that capture can occur where utilities is planning to extend the network. So, for example, utilities can extend the network to location which people are richer and can pay more money, for example, have more return as compared to extending the pipes into locations which are poorer. So I think it is important for people to be able to get involved in the business planning of the water utilities, and that the process should be transparent. I think that is for now. Joe, back to you.
Yeah, great. Thank you, Sitaram.
Yeah, thank you, Joe, for the quick recap of all the programs that have, all the presentations and sessions that went through yesterday. I was able to go through some of the presentations that were loaded on the website. The website is pretty useful, but I had some issues accessing the website yesterday, maybe the internet issue here in my place, or I don't know what. But there were some reflections from what I heard and what I've seen the past couple of decades at the grassroots. Yeah, inequities, inclusivity, leaving no one behind, and reaching the last mile. These all have been familiar terminologies for most of us in development sector, and we've been saying that for many years. Looking at the presentations yesterday, I got some mixed feelings. One was in the plenary, what was highlighted or what was mentioned was that this issue of inequities is getting sort of mainstream. Now, everybody seems to be talking of inequities. It's not just a small fraction of development workers who are trying themselves first. It's being heard and being spoken about. So that was something that was heartening to note. But then in the plenary, like Joe mentioned, what also came through was that perhaps some of the interventions themselves, some of the ways in which interventions are being planned are themselves perpetuating inequity, like the rural-urban divide and the providers deciding what people get, seems to be pushing the divide between those who have and those who don't, pushing the divide much bigger. So that's something that we need to reflect on. And in fact, that was very rightly highlighted by one of the panelists there, where the very design of some of the research questions and the research tools was something that needs to be introspected. The way we frame questions and the way we derive answers and analyze them perhaps brings in a lot of bias, which is furthering inequities rather than reducing them. So I thought that was sort of mixed feeling where you feel, okay, we are talking of inequities and we are trying to reduce them. That's all right. But then maybe the way we do it needs to be again relooked, and perhaps there are some changes in the way we approach things that are essential. And as I saw the other presentations, this feeling was further strengthened. There was in the culture related presentation, there was one about women and workplaces. And how the challenges that women face in accessing basic sanitation as well as specifically menstrual hygiene. We have worked extensively in many workplace settings in garment factories, reaching out to nearly 100,000 women workers. And this was nearly 4 or 5 years ago. And we did try to work with the owners of those garment factories and bring about certain systemic changes within that framework. But then the presentation again spoke about very similar issues of challenges to access and women continuing to restrict intake because they would otherwise be compelled to use the toilets which don't exist or can't be used. So when I heard this, I again felt that perhaps we've been talking about these things for quite some time now, and it raised the question in me whether we are really being proactive and trying to address the issues the way they should be. We've been talking for some time, and maybe enough action is not there on the ground, and something that we all have to look at and bring in some systemic changes so that things do change. But having said that, I have seen significant improvement as well. It's a slow process. And one other point that I would like to make was about a presentation in the non-household settings. There was a presentation on healthcare facilities being provided a chlorine generator unit. I've had some experience in working with healthcare settings in the state of Karnataka in India. And again, being a medical professional, I feel pretty strongly about it. And the COVID situation, the COVID pandemic has really brought the role of basic sanitation, basic hand hygiene, and simple things like distancing, especially in places of high footfall, including healthcare settings. So we need to think about that. So it did present the effectiveness of chlorine as a sort of disinfectant agent to be used in places like healthcare settings. I just wanted to share one point about the current context of pandemic. Perhaps it could be expanded into the other sanitation tools as well. Maybe a disinfectant being produced on mass scale with community participation. So we have a program where we are trying to encourage women, self-help group women, to come up with some simple products like disinfectant solutions. So that can perhaps not only make such simple facilities available in rural areas and bridge the gap between the urban and rural or the left out communities, it can also be a livelihood option. So when we look at sanitation and the needs holistically and try to understand the living conditions of people and thereby address them more comprehensively, perhaps we will be able to bring about some changes in the system approach and thereby address major inequities. So that those were some of the thoughts that I had. Perhaps more as we move on. Thank you.
Great, Juliet.
Sure, thank you, Joe. So great to hear from both Sitharam and Melba directly from the region. I managed to watch a couple of the presentations. So yeah, shout out to UNC for the website. It's very easy to use and to be able to rewatch things, and you don't have to watch it all. You can find different points to jump in. So some of the things I took away from the plenary around inequalities was yeah, particularly this idea of bad aid and well-intentioned investments and interventions that actually may be perpetuating inequalities. And I think that is something that's really captured our attention as researchers. It's something we've tried to work on in the region. And I think relating to back to something Mova said in Indonesia about when utilities expand services, who do those services go to? So this question of who benefits. And in Vietnam, where there are a lot of small piped water service providers, we did some research looking at that same question: who benefits? Are the poor being systematically excluded because these are private providers and they've got a certain economic model and financial incentive to serve those who are closer, closer knit and not in more remote places? And did demonstrate that there are systemic inequalities. And I think it points to the importance of research for pointing out and demonstrating and making visible inequalities, and also that we need strengthened monitoring systems to really understand who's being reached with different water and sanitation services. And then another thought that came around this well-intentioned interventions for me is around on-site systems and urban sanitation. So one of the presentations by a colleague this morning, Tim Foster, on research we've done in Dhaka is starting to show, we're using on-site systems, a lot of them going direct into drains and stormwater systems, and that they're basically leaking pathogens straight into human living environments. And so this question of, do we believe in the solutions that are being supported and endorsed and invested in different places, or are we really paying attention to the outcomes that are happening and questioning our approaches and questioning how we copycat what's been done in the past rather than perhaps maybe rethink when we need to? And so then jumping to a different area which came up in the inequalities session was really around gender and social inclusion. So different dimensions of disadvantage and getting beyond the idea that it's just about the poor who are disadvantaged, but rather that there are multiple different dimensions of inequality. It can be to do with disability, it can be to do with religion or ethnicity, it can be to do with race, and that we need to kind of broaden our view on what social inclusion means. And that's something I think for those of us in this region that's being really spearheaded by the Water for Women Fund, which has, I guess, both implementation and research that's focused around this theme of gender and social inclusion. And so for those in other regions, hopefully you'll be able to draw on the resources and the learning that happens through that fund. And I think in the UNC conference, it was great to see the sessions around gender equality. We've really moved a long way. We started off with, I think, a focus in the sector on gender equality just at community level, and about women's participation in committees was the most kind of typical gender equality presentations you might see. And then when you look at the diversity in the program of both the posters and the sessions, we're looking at MHM in workplaces. We're looking at women on boards in water utilities, and we, as part of the Water for Women Fund, are doing research on women in the WASH government workforce in both Indonesia and Cambodia. So I feel like that's a really positive trajectory in terms of thinking about gender dynamics, social inclusion in a much broader sense in the sector. So that's enough from me, Joe. Back to you to move on.
All right, I think we may have lost Relvi. Hopefully she can rejoin. But, so go ahead, Jay.
Okay, I've got 4 points that came to me from today's session. So I'll first start with the inequalities discussion. I really felt like this message of challenging the level of service that people think can be provided was just a very powerful and hopeful message. And it really reminded me of Paul Farmer and the work that was done around HIV/AIDS, where people began to challenge what they thought could be delivered to poor rural people in terms of HIV/AIDS medicines. So, and I think that we've got sort of a similar task at hand in the WASH sector. Related to that, I think one of the things that I think that we need to raise attention for, and this comes to one of the presentations, which was on water transport or water fetching. So they were looking at water collection labor and seeing how temperature and rain affected water collection labor. And I think it's interesting that we have made specific goals around ending the practice of open defecation, but we haven't been as vocal about saying we need to end this practice of water collection. Should not be happening today. We got to stop this. So that's something I'm really passionate about, and I got hopeful about really challenging these levels of service. When it came to the sanitation discussion, I really liked this, one of the points that was made that, that sanitation is not a one-time expense or a one-off kind of event, but it's about this ongoing system that we've got to think about. So I really, it made me think about, thinking about sanitation as not just a toilet, but all the things that go into maintaining the operations and maintenance of that. I personally now I'm going to go into some things that I questioned, which is, one was this idea that modeling fecal pathogens, something that I actually do, is actually going to generate technology choices. It's going to change the technologies we pick just because we can model certain fecal pathogens associated with those. My underlying belief is that it's going to be the cost of the technology and it's going to be experience with the technology in the local setting that's going to drive that technology being used or not used, not whether fecal pathogens are present with that technology. So hopefully that's, will create some debate. Maybe we can have a little debate here, but it's all meant to be friendly. And then I really liked the presentation on wash disasters that was given by Danielle Lantain. This is my last point. And I really thought that it really reflected listening. Here's a very difficult situation where we can't do very good research in disaster settings, but she went out and set out to listen to the people who are trying to respond to disasters and how do we improve that whole situation of the wash clusters, improving the response. And I really found that kind of inspiring research that she did.
Everybody's talking and nobody's listening. That's everywhere right now. And I feel like especially, so some of us talk way more than we listen, and I put myself in that category, unfortunately. Okay, so we've all given our little recaps. I think now the floor is open. We've got a couple of open questions over here in the Q&A. One is maybe a basic one, was just what is your country doing around supporting water and sanitation issues, I guess, especially inequality in your country? That would be an interesting one. Thanks, Jan Willem. I'll shut up now. I've been chastened.
Yeah, I'll go first with that. In India, there has been a tremendous, very rapid progress in sanitation coverage as well as water supply coverage, and equity, inclusivity is being spoken about and given much bigger attention than it used to be, perhaps in the earlier days. So the responsiveness of the system has improved, but then the sheer size that we have here, each state is perhaps the size of a European country. So the sheer size makes it a much bigger problem than what it actually is. But having said that, the efforts in bridging this inequity gap are definitely visible. We do have still a long way to go. And in the region, the network that I am associated with, FANSA, Freshwater Action Network of South Asia, has been focusing a lot on bridging this gap. And so we have got a lot of insights on how these inequities come up and how they impact wash services, and we have systematically we are continuously providing some of these insights to the system, to the government as well, including the leave no one behind the process and the community interactions during the voluntary national reporting on the SDG 6 progress and such other opportunities. I'd say we are doing much better than what we used to, but there is still a lot to be done, particularly in this region. And the question of targeting, specific targeting the ones that are traditionally left behind, like let's say the women, the persons with disability, and the elderly, and institutional settings like schools. So these are definitely getting adequate attention, at least in the policy. So that needs further work now into conversion into actual implementation.
Okay, we have
So
another.
Joe, it's yours.
Okay, all right. There's a couple of more questions. If anybody wants to take one from the panel in the question box.
I'll probably take the issue on country support in Indonesia. Well, I think the proliferation of water access is quite good, although the quality remains problematic. I think sanitation and wastewater is still largely an underdog. In the urban areas, probably major cities have only 3 to 5% access to sewerage. In the rural areas, quite a lot of villages now have obtained, I think, the open defecation free status. So that's a good progress. But in terms of the national policy and regulation, unfortunately, we do not have any high-level legislation on sanitation. So it is pretty much still under the existing water law, and I have no idea why it remains an underdog. So I think this needs something that needs to be pushed. Thank you, Joe.
There was one question about the sanitation products being produced by women. Thanks, Lajana Manandar, for bringing that up. And you are very right when you say that quality is of prime importance, and there is no doubt at all about that. And we need to definitely pay adequate attention to that. So what we are trying to do is to bring in the necessary technical expertise into this as well. In fact, we are implementing it with UNICEF support, and the commitment is to adhere to the technical standards of accreditation specifications that are laid down and approved by the WHO. So I am going for accreditation as well by appropriate technical body in terms of its antimicrobial properties and safety on usage on body parts. But also what I feel is it's important to look at it from end-to-end solution point of view, and not just the technicalities of the solution that we prepare, including how the raw materials are procured by the women and how the marketing is done. So that complete picture will be important to make it sustainable. Because I also feel that if such things are available easily at rural areas, then it will definitely have a positive impact on behaviors which are going to be sustained for years. So it's not just about COVID or the lockdown period that we need people to wash hands and keep their surroundings clean. This has to become a way of life. And in fact, that is what sanitation is. That's what hygiene is. So from that point of view, we are trying to look at it from the broader perspective of influencing behaviors at the community level, and if it is of good quality, I'm sure it will sustain. So thank you very much for bringing up that point. You're very right.
There's another question, should be an easy one. How do we make equitable and inclusive WASH happen at speed and at the scale that it's required? I mean, I think so. From the panel today, I mean, what some of the things that people said was, you know, obviously we're starting to measure this now and explicitly incorporate it into our programming, and that's obviously a good thing because you can't pay attention to things if you don't have any data on them. And obviously listening came up, and sort of other kind of attitudinal changes that are needed in our sector. I think we're all points well taken, but other ideas from the panel. What does everybody think on the major question is how do we get beyond a place where systemic inequalities are so visible in the work that we do?
Yeah, so I'll just add voice what I just put in the chat, which is really just that obviously we need governments in leadership roles to change things, but they're not always going to have at their fingertips all that's needed. And so I think the voice of civil society to represent those who are not served, and the role of research, as you just mentioned, to make more visible inequalities and greater engagement between those groups. So I feel like multi-stakeholder approaches, whether they're right down at the local level or they're at the national level, are really important. If they're centered, if the dialogue centers around this issue of inequality, then we can both bring together the evidence and develop the strategies that can address that.
Yeah, I think from the points that came up and from the grassroots experience that we have had, the most important thing is to the willingness to listen and to respond to what people are saying. The rigidity with which programs are implemented sometimes are the biggest hurdles. So we need to be contextual. We need to be flexible in tweaking some of the implementational, guidelines based on the context. And this can come only when we are ready to listen and respond to what people say. So participation by the affected communities and getting their insights into what programs we are implementing is extremely important. Otherwise, like what was mentioned and what has been our experience, many of these schemes and programs themselves perpetuate further inequities. One more thing is that the goalposts are continuously changing. It's no longer enough if there is one common toilet for the whole community in one corner of the street. No, we need to look at going further up and improving the quality of services. So I think that way, continuous look at what we are doing and how to improve. So that's something that's very important. Thank you.
Okay, well, I'm aware of the time. We're right at 11:45 my time. I just want to ask any of the panelists for any parting words that you want to offer to the attendees. I'll go first and just say we really appreciate everybody who joined this session, and it's an incredible privilege to be able to reach out to everybody. And I'm sorry that it's so brief, but I hope that you take the opportunity of looking through all of the resources from the conference, because it really is, there are a lot of rich discussions going on, and I've benefited enormously from them, and I hope you do too. So I'll say good night, and everybody else can go around if you want to.
I'll just say thanks. It was great to be here. I love the WASH community. I miss seeing you all, and hopefully we can be back together in person one day. Yeah. Same here. Thank you for the opportunity, UNC. It just reiterates that learning should never end. It's a continuous process, ever enriching. So it was great to be part of this conversation, and great to get to know all of you. So I hope to be in touch, and hope we will do better in terms of interactions as well as implementations. Thank you. Have a great time.
Yep, so I'll sign off too. Thank you, everyone. Thanks for the chance to interact with the other panelists. I mean, one of the beauties of this new COVID world is being able to interact. I haven't been to the actual UNC conference before, but this year I feel like I actually went. So there you go. Things are surprising. So thanks, everyone, for attending.
Yeah, so thank you very much for the opportunity. It's an honor to be here. I really enjoy the conversation and listening to our experience from everyone around the world.
Good night, everyone, or good morning, and have a good day. Bye-bye.